So welcome today to everyone to our webinar or online information event on understanding cognitive behavioural therapy or CBT, your CRPS and chronic pain. Our speaker today is Daniel Leach. He is not just a trainee cognitive behavioural psychotherapist, but he's actually also one of our volunteers within our counselling and therapy service. So Daniel, over to you and welcome to the team.
So thank you, everyone. It's really nice to see such a big turnout, on today's recording and webinar on CBT for chronic pain and CRPS. And I've really thought it would be really interesting today and really good to look on CBT, especially when there can be a big stigma, with people with chronic pain. I have pain myself as well. So I understand how it can be for many people as well here today. As I said, we will do some questions as well at the end. And I have tried to incorporate a lot of the questions in today's webinar as well. And if you have any that comes to mind, then please put them in the chat function. And I will try my best to answer them as best as possible. Okay, so go on to the next slide. So the aims of the webinar today are around what is CBT to start with, what can CBT help with, how does it help with pain as well. Also as well, I put in what's the difference between CBT and counselling as well. What actually is a psychotherapist? That can be quite a big name when you hear that psychotherapist term, but actually, well, what is it? What does CBT involve as well within the sessions? What sort of things typically would that session include as well? And are you actually able to sign up to CBT or counselling with Burning Nights as well? And actually, how do you do that as well? And then when you complete that form, what will happen next? And I also wanted to do a section as well on myth busting as well, because there are some myths out there on CBT as well, which I thought would be good to have a look at and try and remove and reduce the stigma on CBT. So the first thing is what is CBT? And it is our relationship between our thoughts, feelings and behaviours as well. So what you think and do can affect the way that you feel as a result. So you can see on the right hand side there what we think affects how we act and feel, how we feel affects what we think and do, and then what we do affects how we think and feel. And CBT is a talking therapy, but it's also a doing therapy as well. And that means that there is an element of doing some form of work in between the sessions. And the reason for that is because, you meet with the therapist for 1 hour a week or whatever it may be. But then there are other hours as well within that week that, you can help yourself and basically become your own therapist ultimately, with the tools and things like that we look at within the session to help going forward. It is present focused, which means that the thoughts and the feelings in the here and now, that's what we look at and address. However, how you think, feel and behave in the present is influenced by what has happened earlier in your life, which also may need addressing in therapy as well. So especially for like PTSD, post-traumatic stress disorder, where there is an element of what's happened in the past, is troubling yourself or whoever it might be, then that also can be looked at as well in therapy. It is an evidence-based form of psychological therapy. It is, really evidence-based in anxiety and depression and things like that, which we'll have a look at in a moment. And it is collaborative as well. It requires active participation in order to prove helpful. So therapists and clients, people, are no different from one another. We're both in the same playing field, so to speak, but it is about helping you step by step and guiding you to help whatever your needs may be, and ultimately what your goals of therapy are as well. Okay, so sometimes through no fault of our own, people do get stuck in these vicious cycles. Things that they do to solve a problem can inadvertently keep it going. So, for example, as you can see there, I'm useless, no one likes me. So that could be that belief, that thought about yourself, that then makes you feel very sad, demotivated. And then as a result, you're tired, lethargic, and then you retreat into yourself. So that's that behavior in terms of that triangle there. So you cut off from other people, and then fewer good things happen. And then it viciously goes round and round and round, and you get negatively stuck in that pattern. So what CBT is about finding out what keeps us stuck, and then making those changes as well in our thinking and actions in order to improve the way that we feel. So what can CBT actually help with? So it can help with anxiety, massive evidence base around that in terms of panic disorder, social anxiety disorder, post-traumatic stress disorder, obsessive compulsive disorder, generalized anxiety disorder, health anxiety and phobias as well, depression, really helpful within that, and also with burnout as well. And that's something that I really want to make kind of key here, is that it is really, really prevalent for people who care for people with CRPS or any long-term condition, that burnout can be as a result of you caring for that person, or whoever it might be. And also with yourself as well, you might literally feel burnt out because of all the stresses and managing your condition, maybe a lack of sleep there, and you feel really burnt out. So it can also be on both ends of the scale as well. So CBT can help with burnout. Tinnitus as well. There's some real big new research around tinnitus for CBT, so that can help with that in terms of managing that and the noises that you may get from that. Psychosis as well, which is on the spectrum, schizophrenia, that can help with that as well. Sleep problems such as insomnia, so we can definitely help with that in CBT in terms of making little changes in day-to-day life. Eating disorders as well, such as anorexia and bulimia as well. And chronic pain, chronic fatigue syndrome as well. Plus much more out there. There is complex PTSD, complex OCD, etc. So what I'm trying to say here is that there is a big evidence base for CBT on many issues that people can present with and have to live with really on a day-to-day basis. So actually, how does CBT help with pain? And a question came on this morning around, does CBT reduce physical pain, or does it work by stopping us stressing out and releasing these stress hormones and exacerbating them? So this here looks around the first element of that in terms of CBT for pain takes an active problem solving approach to tackling the many challenges associated with the experience of chronic pain. So rather seeing yourself as helpless or disabled because of your pain, CBT encourages you to take back that control and re-engage in activities. There are several key components to CBT for chronic pain, and that includes learning how to recognize unhelpful thinking errors, which assist with identifying and challenging unhelpful thoughts related to pain. So that looks at things like unhelpful thinking styles, that when we're in that negative mindset, and that is common as well, we can all feel like that on a day-to-day basis. But we can do things like mind reading a little bit. So for example, if you are out and about and you feel like people are staring at you, then you can think, oh, Are they thinking, the way that I look or the way that I'm walking or something like that? Where actually they may not be. But when we're in that negative mindset, we automatically presume that that's what might happen in them moments. Relaxation training as well. So there's things around breathing, progressive muscle relaxation, visual imagery as well. So they are things that we can do to help to calm down the body into a more relaxed state, which can then reduce that stress hormones in the body. Learning how to become more active without overdoing it. That is a big thing, something that I tend to see when people come to see myself. But it is pacing needs to be maybe something around that. Because I think when we get on the day-to-day life, we're busy, we've got kids to look after, that sort of thing. It can be very, very difficult to pace. But it is looking at that, and that's one thing that we can do in CBT. And there is that in-between session work is designed to decrease avoidance of activity as well, and reintroduce a healthier, more active lifestyle. And by activities, that doesn't mean maybe necessarily going for a walk or something like that, or doing whatever it might be, but it could be engaging in a game or just gardening outside or watching TV or whatever it may be, but that stimulates your mind, and that as a result can help with stress and things like that. Also, it helps to engage in activities. It makes you feel better, the fact that, you might be doing something that's engaging as well. Okay. So also, how does CBT help with pain? So there can be a correlation between pain and anxiety conditions and depression. So there is a comorbidity, I think, there with pain. We can also work on anxiety and depression as well as the pain, but it does depend on what the goals might be out of therapy. And we'll have a look in terms of the SMART goals in a moment. But also, what's the biggest impact in your life right now? So if you come and you are really anxious, or what have you, maybe around your health or just around general things in your life, then that might be the biggest impact for you right now. But as a result of that, that might then help your pain because of the stress of the anxiety. That stress hormone going around your body can then impact your pain. So it might be that we look more around your anxiety, and then that might influence and affect your pain positively. By working on the anxiety and depression, as we mentioned there, the pain can improve, even if it's just a little bit. For example, if you're not engaging with others and staying indoors due to your pain and becoming depressed, engaging in activity can release endorphins and serotonin. And it is a good point to note here that serotonin and endorphins is a natural painkiller in the body. So that can help in some way, even if it's just a little bit. Hopefully that can help in some way. So I have put here a little bit of a slide around actually how does that work, especially in relation to the question that I got this morning. But it mentions there that when you have acute and chronic pain, a signal can travel from the site of the injury through the nerve fibers to the spinal cord and then up through the brain. Now, the brain interprets the signal and you perceive the pain, as you can see. But there is a theory with the gate control theory that there's a gate in the spinal cord that can open and close based on the input from your brain and the body. So the things that can open the gate is the attention to the pain, that the pain is a terrible thing, depression, fear of anxiety, stress on the body. Now, obviously that, when the gate is open, more pain can arise, and you can experience more pain. But things that close the gate might be, shifting that attention from the pain to some form of activity or doing something else, whatever that may be. It could be relaxation, appropriate pacing, social activity, that sort of thing. They're the sort of things that close the gate, therefore having less pain as well. So, so that's in response to that particular question. Actually, does CBT reduce pain signals to the brain? Well, yes, it does, as mentioned with this, because we can look around, increasing activity at your pace as well. It's a step-by-step situation, that gradual step there. And does it work? Does CBT work by stopping or stressing and releasing these stress hormones? Well, yes, it can as well, as shown. So there was another question as well this morning about is CBT more effective than acceptance and commitment therapy, which is another form of therapy. Now, as you can see, you've got CBT, which is an umbrella. And within that umbrella of CBT, you've got, mindfulness-based cognitive therapy, behavioural activation, cognitive therapy. But then there is that acceptance and commitment therapy as well. So CBT is that umbrella term, and within that, there are these other therapies. Now, ACT, which is acceptance and commitment therapy, is accepting the condition, which can take time, which is really difficult to do. There is really, really positive effects on that. And it is not just accepting your condition as well, rather than fighting it, but it's about steering you towards values in life. So, for example, you're on a boat and you are steering towards your values. Now, you realise that there's water coming in at the side of the boat, there's a hole in the boat and water's coming in. You're thinking, oh God, how am I going to survive here? So let's just take that hole is the pain. So you get away from the wheel and you go to where the hole is and you try and scoop out the water with your hands, or a bucket or something like that, and you're really, really trying, and you're putting all your energy and fight into that. But acceptance commitment therapy is more around going back to that steering wheel, because you're using a lot of energy and a lot of fight towards getting rid of all that water. But can we do anything about that at this moment? Because the hands that you're using to scoop out that water, is it effective way of doing it? The water's going through your hands and things like that. So it might not be the most effective way of doing that. So it is around going back to that, the wheel, and steering towards your values instead of spending all that time doing something that might not be helping anyway. So it is around accepting your condition, but also accepting thoughts as well for what they are. And it also helps, as I mentioned, to focus on the values which are meaningful to you. So research says that actually ACT and CBT are, equally as effective as one another. Okay. So, what is the difference between CBT and counselling? So, counselling is a type of psychotherapy that involves talking to a professional who has been trained in helping people work through negative feelings or experiences. So it's a great opportunity to talk things through, get things off your chest, and have someone to listen to you and validate your feelings and experiences. It can help you to develop insights which may lead you making more helpful choices, and therefore improving how you feel. So counselling can be highly effective for people with problems such as relationship difficulties, changing jobs, bereavement, or maybe some form of loss in some way, or also negative past experiences as well. So sessions tend to be less, structured. So you can discuss whatever is on their mind in that moment, whether that be a current problem or something that they have experienced in the past. So the goal of CBT and counselling is essentially the same, to help you to feel better, but the journey of how to get there is different. So by understanding the difference between the two therapies, which we've looked at, and which we will do, you can identify what sounds like the best fit for you. So counselling can be very useful depending on maybe what your issues are at this moment in time or in the future. So, what is a psychotherapist? So, many people can hear the word psycho and think like they're going crazy or something like that. These really negative connotations surrounding it. But actually, the word psycho within the word just means mental health. So like psychological therapy, which has been shortened down. So it's that mental health. And a therapist is a person skilled in delivering some kind of therapy. So adult psychotherapists work with adults to assess and treat a range of emotional, social, or mental health issues. And they help adults tackle problems such as behavioural issues, common challenges such as anxiety and depression, or maybe more complex or severe issues such as psychosis or personality disorder, which CBT can also help with as well. So, what does CBT actually involve? So the first thing is an assessment, which includes doing a risk assessment. And that is finding out what brings you here to therapy in this moment. As well as within that as well, we look at a recent incident. So what brings you to therapy, but also it helps to formulate that out, which is looking at that overall bigger picture, at the relationship between your thoughts, feelings, and behaviors. It also looks at vicious cycles, these maintenance cycles, things that maybe you do that maintain the issue. And that's obviously what we ultimately want to break, and do that in a more step-by-step way, and also in a collaborative way, So the risk assessment is very, very key as well, to make sure that people are safe to start therapy as well. And also, if that is the case, then things like safety plans can be put in place as well. Like a plan in terms of if you did feel really, really negative, and in any way were to harm yourself or had them thoughts of doing that, then there is a risk assessment there as well prior to starting therapy. And it may be a case that we look at assessing that throughout therapy, which is something that we definitely would do. SMART goals as well. So SMART is goals that are specific. So, for example, if you're saying about going for a walk, then where to? Is it to the shop and back, or is it just round the block, around the park? Where actually specifically are you going to do that? Measurable. So how will we know whether you've done it, we've achieved that goal? Because if we don't know, or we can't measure that, then how do we know we're going to complete it? But also you might feel that sense of that demotivation a little bit, because you've got this goal there, but you don't actually know how you're going to get there. Achievable as well, so that's something really important. Is it achievable for you? Have you got that resources there? That resources to do that, to do the goal? Is it realistic as well for you? And timely, or time bound. So that is, when would you like to achieve that goal by? But is that realistic, that time as well? And the key with SMART goals as well, it should be short-term goals. So for example, if you're saying that I want to get back into work, that could be quite a big goal for some, but it's about doing these short goals to get to that. Because if we see a big goal, are we really going to want to necessarily be motivated to do it? Maybe not, because it's too big, it's too far into the future. So it might be these small goals. When we achieve that goal, we might do another goal and then get there that way. And that helps, as I say, with motivation. SMART goals also help to guide treatment as well. So when we look at doing SMART goals collaboratively within the session, or maybe in between the session, to give that more time to think about what you want out of therapy, it helps to guide treatment. So then we can look and say, okay, how do we then get to those goals? What sort of therapy can we do within that? So that might be including a little bit of, acceptance and commitment therapy there. It might be a little bit of compassion focused therapy within there. So if there's that inner critic that you experience a lot, that's basically telling you that you're worthless, then maybe we could work on that. And there's loads of things that we can do within compassion focused therapy that can help with that. So that's a really good way to see how do we get there together, treatment as well. So that is, what things that we will be doing to help to treat your issues right now. So as I say, if it is depression, then it could be looking at more your negative thoughts as well. Or it could be in terms of maybe engaging in activity again, making you feel that self-worth again. So there's loads of things. If it's social anxiety, generalized anxiety, whatever it may be. I mean, there's a big toolbox there that we can do together. And then that then helps then in terms of this relapse prevention. So when we come to the end of therapy, then there is an element of relapse prevention. So we sit down together and we say, okay, so what have you actually learned in therapy? What's worked well? What maybe hasn't worked as well? What things would you be doing going forward? What things can you use that we have learned over a period of time that you can use going forward? What triggers maybe that you could experience again, which could then, going down negatively in terms of that spiral again. So what triggers you for that? Because if you're aware of your triggers, then hopefully it's about avoiding them, but also maybe being aware of when them triggers are being there. So then ultimately you've got them tools there straight away to implement. So the relapse prevention is a really, really important stage in therapy. So it is really, really important as well. And also in terms of that, there is an element at the end in terms of, so if you do feel like you are having a setback, then there is an element of working through that. So we can together see how you would then approach that if you were to set back again. Because there is a difference between lapses and relapses. So a lapse, in terms of going back into maybe those negative thoughts again or negative behaviours, a lapse is that short, that short going back into those negative ways, where a relapse is a more prolonged way of those old unhelpful behaviours. So it can be common to have lapses, but hopefully there is no relapses there going forward, because there's then tools that has been learned within therapy to help with that. So what would a typical CBT session include? So at the beginning of the session, the therapist should be setting an agenda together. And the agenda is basically, it's a structured way of keeping to what you want to include within that session. And that helps to, for you to get what you want out of the session as well. And we can come back to the agenda throughout the session to make sure we're on track. And the reason for that is we don't want to, things that we put down in the session to then be missed as well. So it's really, really key setting an agenda. And then looking at weekly items, so maybe events. Since the last session we've had, how's your week been? Since last time we met, how are you doing? So that's really key as well, because there might be some things there that actually we might want to say, we talked about that for a little bit. Should we put that on the agenda today? Because that seems like really prominent for you right now. So that's something that you can do. Feedback on the last session. So that's something really, really key. So how was the last session we had together? Can you remember what we did? Was anything that was helpful there? Unhelpful? Any questions? So it's making sure that if there are any issues there, we can iron them out together at the beginning of the session. Review of the last homework. So that's the work in between the sessions. So we can review that together, see how that was. And then there are the day's major topics. So that is, the things on the agenda that we look at in the session. Then there is that homework assignment. And I know that word homework can be, triggering for some people, especially with school or whatever it may be. But that is the work in between the sessions. So if there's, quite a few hours within the week, then that is there, as I mentioned before, to teach you to become your own therapist, take control of your own condition, but also, ultimately that will then help at the end for you. Feedback as well. So that's something really good at the end to look at, and hopefully the therapist will be doing that. How did you find today's session? Is anything that was helpful, wasn't unhelpful? How can I improve as a therapist for you going forward? And something that I tend to do is, can you tell me one thing that you've learned in today's session that's helpful for you as well, to see actually maybe what was helpful, can I take away from today's session? But also that can be really, really helpful in terms of doing the relapse prevention plan at the end, the management plan, because then if you've learned something, then we can put that straight into the relapse plan at the end. And it does tend to be, depending on the evidence of whatever condition that may be, phobias, generalized anxiety, health anxiety, whatever it may be, that it is weekly sessions. There are times it could be fortnightly sessions, depending on the research or on yourself, but on the whole, weekly sessions is, and that helps to keep some form of consistency as well. Because if there are a couple of weeks of missing, then I'll forget, what's been going on. Okay. So, am I able to sign up for CBT or counselling with burning nights? So I've put on here that, we accept people both diagnosed with CRPS, as well as those affected by the condition, such as parents, partners, family members, siblings, caregivers, and friends. If you are a patient, you must have a formal CRPS diagnosis by a pain consultant. Sign up for our CRPS counselling service. You must live or reside in the UK to take part in the service. And it mentions about, we can't accept you onto our counselling service if you are still attending either NHS or private psychological sessions. And that is that sometimes there might be a conflict there with what one person might say, one health professional to another. So it's just about keeping consistency within that. But there's no harm in then, once you finish with one, to have the other. There's no harm in that. But it's just not at the same time as well. Okay. So, how do you sign up? So, I've put here that, you go to the Burn Nights home page. I know the website might be changing, but on the whole, I think this is the way it's going to stay. Step 2. So, hovering your mouse over the support button, and then hover over how we can help, then clicking the CRPS counselling service. So you're now on the CRPS counselling service page. You can now have a read of the information and then scrolling down to the bottom until you see the heading, how to sign up. And then you read the paragraph, and then if you are suitable, then you are able to complete the application form and sign up. And I've just put there a brief thing around what the application form consists of there. So are you referring to someone other than yourself, for the counselling service? You're always aged over 18 as well. However, at the moment, we do have a children and young persons counsellor as well. But if you are under 18, then your parent, guardian or caregiver needs to complete the form with your details. What's your date of birth? So it's all them key information there. And then there is an element there of, do you agree to completing 2 surveys and monitoring forms as part of the counselling service? So that is really, really key, is that to help to give people on the counselling service more information on your issues right now, that sort of thing. But also the second survey is just as important. It's used for feedback as well, but also another is that it helps to receive funding as well, because at the moment, it is free for counselling and CBT at Burning Nights. So it really helps in order to receive funding, so we can keep it that way for therapy. And then just the contact details there. And then, have you attended any counselling before? Have you been diagnosed with any of the following? Any other mental health conditions? Do you feel you're suffering with any of the above now? And that is the anxiety, depression, that sort of thing. And what do you want to get out of counselling or therapy as well? And when you put, have you been diagnosed with any of the following? That is the stuff that we mentioned before in terms of what it could be. Even if it's tinnitus, phobias, anything that we can help with around that. And then, how did you hear about our counselling service as well? That's really important. So once you've completed the form, what will happen next? So once you've submitted the form, you'll then be contacted by one of our therapists or counsellors to set up an appointment with you. You'll then have an assessment session that will enable us, the therapist or the counsellor, to understand your issues, understand whether therapy is suitable for you, whether it's safe for you, and you'll be asked to complete some forms. So, for example, a consent form as well, and questionnaires on low mood and anxiety as well. And that's what we will complete within that assessment session. So we do everything together. I think it's just key as well on that bit that the therapist or the counsellor, once they've had that assessment, 48 to 72 hours afterwards. So after that assessment, it takes that therapist or counsellor a little bit of time to make sure you are suitable, to look over the information that you've mentioned and to make sure it is suitable as well. So it can take, 48 to 72 hours in order to hear and a response. So there's some myths now in the last section in this webinar that I wanted to try and address with people. As I mentioned at the beginning, there can be a big, stigma with CBT, that people say that it's all in your head and that sort of thing. So I definitely want to put people's mind at ease with this. So, myth number 1, CBT involves a lot of work. Well, actually, it involves as much or as little as you want. Yes, it's different to other therapies in terms of maybe some others don't require that homework. because it does mean doing some therapy, working between sessions. But this might be just for a few minutes each day or a couple of extra 10 minutes a week. And you can do more if you can, in terms of, if it's a couple of extra 10 minutes, you might do a little bit more. Calling it work can be misleading, but it is a word that is mentioned a lot within therapy, and that's why I've mentioned it more today, with the speech marks around it, sort of thing. What you're actually doing is collecting information about what you're currently doing, building on the things you normally do, maybe weaving in activities that you want to do, but it depends on what your issues are, and trying out strategies to help in your daily life. And it depends on what your reasons for requiring therapy are. Often people enjoy this and might choose to do more than we planned, but as I say, this is up to you. This is your therapy, ultimately. And I always make it very, very clear that I'm no different to you. Sometimes there can be that element of, I'm the healthcare professional, and you're different to me, or whatever it might be. But that isn't the case with CBT, with therapy. And there can be those negative experiences maybe that people have had in the past. And I want to really, really make it clear that it's not like that on the whole. And there can be those negative experiences like anywhere in life, I suppose. So I really want to make that really clear as well for people. CBT means ignoring past issues. So as we addressed earlier on in the webinar, that it is true that maybe the focus of CBT is on the present rather than the past. But it doesn't mean that we ignore past issues. It's important to understand problems in the context of the past as well as the present, which is why we do an assessment as well, which always includes understanding your personal history. Sometimes we need to revisit issues from the past within therapy too. One of the concepts of CBT is that we form beliefs about the world, ourselves, and others early in life. So sometimes we need to have a look at these core beliefs in therapy. And that is what core beliefs are. It's, our beliefs on the world, ourselves, and others as well. So it could be, I am worthless. Other people are dangerous. The world is bleak. So that sort of thing. And we can look at those in therapy if that's, if that's what's needed and what you wanted to do in terms of those goals. CBT is like a bandage or plaster as well. I hear that quite a lot. The changes I make in therapy won't last. So this is a myth, and there's a large amount of research to actually back this up, that it's wrong. So within therapy, we're not focused on where problems come from, but instead they focus on what is maintaining them. So change is also not something that happens once a week in the therapy room. It's a process you take home in your daily life. It's helping you to become your own therapist with all these tools here, and look at it in that way. Towards the end of therapy, we focus on our work and work on maintaining progress and managing when things get difficult again. Hopefully not, but it is common that people can lapse and have setbacks. This means that once therapy ends, it's not such a change as well. So if we do all this and there can be an element maybe of reliance or whatever it may be, that then we've kind of given you the tools throughout. We're also giving you that ownership, that empowering yourself to be more in control as well. Then you just continue to do the work that you've been doing. And the work that we complete in sessions teaches and empowers you to become your own therapist, as we mentioned then. Myth 4. So CBT is structured, so I cannot talk about what I want to in sessions. So it's key, it's really key to say that there's always space within sessions to talk about what you want to talk about. And a therapist should always encourage and welcome people, clients, yourself, to bring their own materials into sessions. So sometimes we will use this content as our therapy work in the session. We might weave in some structured content in, or look at difficulties that have come up for you in your week with a CBT lens, or problem solve different ways to approach a situation. As I mentioned earlier on, when we're in these negative mindset, sometimes we don't see, we cannot see around us because we focus on the negative things that are going on in our life. But sometimes in CBT, we look at a more open approach, and that can be hard to see, but we can work on that together. That's what we should be doing. CBT is just for adults. Well, CBT is for children and teenagers too. The content will be different for kids, so that it's accessible. Might just be a different language, that they use different worksheets, that sort of thing. It may be doing more play-based and active work and less sit down and talking way. Parents as well might be in the sessions, and there's some evidence there that parent-only sessions can help. Teens often get on well with CBT. Again, sessions can be adapted, as teen issues are not the same as kid or adult issues as well. And also, it's important to say as well that CBT can be helpful for people with neurodiverse conditions as well. So like autism or whatever it may be, we can adapt the way maybe we do certain things. And it might be some things in therapy. For example, we can do things like grounding techniques and things like that. That might be difficult for some, but we can work around that. So it is really accessible for and effective for people with neurodiverse conditions. Myth number 6. So in CBT, I'm just going to be told I should be thinking or acting differently. So CBT does involve making these changes, but it is a gradual process. And it might not be the change that you're expecting it to be. We both look at your situation in a new way, but like exploring to start with, and then we can find out together and then work out the best way change can happen. Sometimes it's only small daily changes. Sometimes, sometimes something happens one day and then it suddenly, shifts. And we work together. It's collaborative. We're here to help you every step of the way. The next myth, the 7th one, I'm going to be made to do things I can't handle. Well, there's 2 issues with that statement. You should never be forced to do something you don't want to. Having said that, some mental health issues take bravery to tackle. Where we've been used maybe to do things a certain way for so long, to live with conditions with pain for so long, it can be very, very difficult to change that. But that's why we work together at your pace. And then when leaving therapy, there are tools there to help to manage. The second part of the statement is also untrue. We work together, so you can handle what we tackle in the session, doing it gradually as well. The 8th one, I don't need to go to CBT because I can get it from a worksheet or online program. So there are so many CBT-based programs out there. They have value and can be hugely helpful for some, but they are not CBT. The difference is that they take on the concepts of CBT and apply these so that they are relevant to most people. So it's a very generalized program. Whereas in the CBT, in terms of having it online, face-to-face, is that it is relevant to you. It's personalized to you. And we will use the information and what works for most alongside the information we have about your situation. So we can kind of see actually what works for you and what doesn't, rather than just a generalized approach. And again, we can paste the content as you need and adapt it as well. CBT is not for me because my mental health issues are too stuck for me to change. So when we've been living with mental health issues for a long time, you know, we feel that it's just part of who we are as people. And like CBT, like any therapy, but CBT, you know, takes work and time, and it will not be effective for everyone. Change is possible at any stage of life, at any depth of despair, and however long you have been struggling. What might not be possible is for you to hold that hope that it works. And this is really understandable. But the key is that we start with one session, and we work from the stuckness. We take it one step at a time. And then after that, it's practicing the interventions that you've learned in CBT is very, very important as well. And another big one I hear a lot of as well is CBT is cold, it's clinical, you know, and relationship, you know, that therapeutic relationship is hugely, hugely important in therapy. As a therapist, they should be someone who you feel safe with, someone who listens well. You should feel supported and understood. Yes, there is structure, and we often will approach problems and situations in a scientific way to try, for you to help, to understand them more. So, for example, it could be looking at the fight or flight system with anxiety. So when we look at, education, sort of educating you on the issues, it could be looking at the fight or flight system and how anxiety actually works, if that's what it might be. We are also two humans working together. And as I mentioned, I'm no different to you. The therapist isn't either. We're all humans. But, they should have that warm, empathetic connection. And that is really, really important. And the final one is, I've tried therapy before, it didn't work. So if you've tried in the past, it didn't work for you, then it doesn't mean that therapy isn't right for you because of that past experience. It may mean that the therapist wasn't a good fit for you. Maybe there was a personality conflict. Maybe you saw one gender and you would prefer a different gender. Maybe the therapist wasn't trained in a particular type of therapy that worked for you. So for example, at Burning Nights, with myself doing CBT, I also use other therapies as well. So attention commitment therapy, and things like that, and compassion focused therapy. There are just a few reasons why your therapy may not have gone well or didn't work, but do not give up. So now we've mentioned, and I really hope today has been helpful as well around CBT. There can be good and bad experiences at times, but it shouldn't discourage you from accessing CBT. So I'd like to welcome any questions.
First of all, thank you, Daniel. And a fantastic speech and really insightful, certainly into the world of CBT. So Rachel gives a clap, so definitely good. There's been a couple of questions, one of which I don't think you'll know the answer to because we're not a USA-based service. Question is, do you know any therapists in the USA? Which no. We don't. But in answer to that, I would contact RSDSA in the United States or CRPS Forum. They should be able to offer you a list of specialists who may be able to help. There has been other questions. With your myth buster about CBT, is a plaster not a solution? Is this perceived because some people don't carry on the work after they've been discharged from CBT?
Yeah, so that can be the case with some people. And I think that's why it's when we're in therapy, it's really good to practice the techniques that have been learned. That can be the case, but also sometimes, people can access CBT multiple times as well. So sometimes even when the R tools are accessible for some people, we can think about, we still get really negative. We can get in that cycle of maybe that they don't work, they won't work for me now. And so, yeah, it is really, really key to use these interventions and, continue them throughout therapy. And that can then be really, really helpful to do. that can be the case, that it can be some people maybe not using them. But as I mentioned, sometimes people do relapse and then they get really, really negatively in that vicious cycle. They get really stuck in that vicious cycle again. So then it can be really hard to, to use these interventions again. Sometimes coming back to therapy, look at how therapy was last time. Maybe what did you learn from therapy? Was it helpful? Was it not helpful? And then there might be an element that we can use them skills again, or it might be seeing actually are there any other skills out there that you can use. So that can be the case, but not always.
Thank you. Next question. What advice would you give to someone who is waiting for their first appointment and has already a negative mindset of CBT? Person goes on to say, I had a negative mindset while I was waiting. I kept thinking it's not going to work. I'm never going to get better. It did work for me and I wish I had a different mindset, or someone give me advice to think positive going through it and into it.
Yeah. So I think that is really hard. I'm really sorry to kind of hear that's what it can be for some people, but it is really, really common, and it is normal, I think, in life, that we can all be negative at times. We can be in that negative mindset. So what advice is there? I think, it is really difficult. I think just accessing that support out there, and I think that this is where, we can't kind of sometimes change things like if you're on like an NHS waiting list, because it can be so long. The alternative to that is private therapy. Well, that can be really, really expensive in these times. So expensive. I mean, I see it all the time where people can charge, extortionate amounts of money for therapy. And I don't know who actually has the money for that. So that can be really, really difficult as well. And what I don't want, to happen is there's going to be that divide within people who can afford it and people who can't afford it. So that is my big message when I do finish next year, is to try and make things much more accessible for people out there. So I think it can be really, really difficult when you're on that negative mindset. I think it's remembering, that there are people also in that same situation to you. It is really, really common. Having the support around you, and I think this is where Burning Nights is really good. Part of the befriending service, and things like that. There's that chat out there, that chat system as well. Trying to maybe engage in some form of activity, going out for a walk. It can be difficult, sitting in the fresh air if wheelchair user, having that, having that kind of people around you if possible. It can be really difficult when you're waiting, but you're not alone within that, and we are here for you as a charity as well.
Thank you. Lorna said it was excellent, and Daniel, very informative and helpful. Wendy has said, I'm already on Burning Nights waiting list for counselling. Will I be offered CBT? Daniel, do you want to answer that, or would you want me to answer?
So if you would like CBT, then that's definitely something that we can look at. I think if you so on the slides here, so going back there, there is an element of, as long as you are in the UK and you've got a diagnosis, so all that when things have been checked on the checklist, then there's no reason why not. Is there anything that you want to say on that, Victoria?
If you're already on the list, then obviously you've probably been checked out. The confirmation of diagnosis has already happened. If you are interested in CBT and you're still on the waiting list, and that's something you definitely want to do, then please inform Lucy, and she will be able to put on a note onto our system to put you under Daniel's list when the time comes. Sadly, all our lists are still fairly busy. We're looking at a 3-month wait, but it is slightly better than the NHS at 2 years wait for CBT. So hopefully, if that's what you want to do, then Wendy, we can add you to that, to CBT's list and Daniel's list. That's no problem. That's all the questions I have. Does anybody want to unmute and ask Daniel themselves? Please feel free to unmute.
I'm more than happy to answer any questions.
Vicky?
I mean, I tried to like word it in the chat, but I'm useless at doing it. But do you have to be, say if like, I don't know, someone's experienced a trauma, do you have to be a certain, somewhere along that like journey of dealing with it mentally for CBT to be most effective, if that makes sense?
Yeah, so that's a really, really good question. So thank you for that. So it can be that for some people may not be ready to talk about it. So I think there's no set answer on that. I think it's for each individual person.
Yeah.
If you're ready to talk about that, then it's really, really effective. And there is some really, really good evidence and good treatment out there for PTSD, like for all of them anyway. But yeah, so I think for that question, for some people it's not right at that moment. So with PTSD, I think it's important to say, so if you have a trauma and whatever that might be, there's what the evidence is that you don't have CBT or anything like that up until a month. So from that trauma, from that date to a month, you can't have trauma. You can't have CBT. The reason for that is that there's a watchful waiting thing. So there's that processing within that memory in the brain going on into that long-term memory. Because what happens in trauma is that the brain doesn't go into long-term memory. It goes into the amygdala in the brain. That's the fight or flight system. So there can be gaps in memory. So that's why it can take a month.
Yeah.
After that month, then yes, you can have therapy.
Okay. Almost like personal, like based on each individual. And I think you have to be somewhere mentally anyway to like be ready to accept, like to get help with CBT anyway, if you know what I mean. Like you have to be so far along and be accepting of it and everything before you can actually like properly be ready to go for it, I suppose.
It's exactly that, yeah. And it can be really, really difficult, even if even if it's years down the line, to then bring it back up again. But you are right, it is really individual, isn't it? And it's when you're ready, because it can be really, really debilitating. And we are here to listen.
Okay. Thank you.
There is a question in the chat. Can someone apply for CBT with burning nights if they're awaiting diagnosis? I will answer that one. No is the answer to that, simply because it may not be CRPS or chronic pain that is the end diagnosis. To be honest, we have to wait for that diagnosis. It can't be from a physio, it can't be from MSK services, it really must be from a consultant in a pain clinic. There are many doctors and allied health professionals that can often say, yes, it's a fleeting comment. Most of us have probably seen it in letters, oh, it's probably CRPS. But that's the reason for us to double check when you do apply that you do have CRPS, or if it's a family member has been diagnosed with it, because it's not just, as Daniel said in his speech, it's not just the patients that we can offer support to, it's caregivers and families. So hopefully that answers your question, Megan. Does anybody else have any other questions? No? Okay. In that case, thank you very much, Daniel, on behalf of the charity. It's very insightful and really informative. And we will be uploading this to our YouTube channel. So please watch out for that. And once again, thank you everyone for joining us, and hopefully you've enjoyed it today. So have a safe day and enjoy your weekends.
Thank you, everyone.